Right then, today we're going to take a look deep inside the human body. We're exploring the world of uroradiology, which is all about the incredible imaging that lets doctors see exactly what's going on inside our urinary system, from the kidneys all the way down to the bladder. How do they find them? You've got these tiny, often incredibly painful things causing all sorts of trouble, but they're hidden deep inside you. Finding them is a bit like a fascinating piece of medical detective work, and that's exactly what we're going to get into.
So here's the plan. First, we'll get our heads around what urinary stones or calculi actually are. Then we'll check out the radiologist's toolkit for finding them. After that, we'll look at the really serious problem of blockages, touch on some other calcifications that aren't stones, and finally see why imaging is so vital when it comes to kidney injuries.
Okay, let's get stuck in. First things first, what are we actually looking for? Well, urinary calculi is just the medical term for stones that can form pretty much anywhere in the urinary tract. What's really remarkable is just how different these stones can be. Someone might have one and not even know it's there. They can be absolutely tiny, like grains of sand, or they can be these enormous staghorn calculi that literally fill up the entire kidney. Now, most of them have calcium in them, so they show up on scans, but some, like uric acid stones, are a lot sneakier. And here's the kicker. They cause the most trouble when they get stuck in the ureter. That's the tube leading to the bladder, usually at its naturally narrow points.
So we know what they are, but how on earth do we actually see them? Well, this brings us to the amazing technology of uroradiology.
The first idea to get your head around is this: radio-opaque versus radiolucent. Most stones are radio-opaque, which means they block X-rays and show up as bright white spots on the image. But radiolucent stones? They're the tricky ones. Think of them like a clear piece of glass in a glass of water. An X-ray beam just passes right through them, making them completely invisible. This brings us to the traditional KUB X-ray, which stands for kidneys, ureters, and bladder. It's a good first step for trying to spot those radiopaque stones. But, and it's a big but, its main weakness is what we call poor sensitivity. The abdomen is a really busy place, and all the gas in your bowel can easily get in the way and hide a small stone. So it's not the most reliable tool in the box.
So let's move on to another tool, ultrasound. This one uses sound waves. When those sound waves hit something hard and dense, like a stone, two key things happen. First, the stone itself lights up like a bright white dot. We call that an echogenic focus. And second, because the sound waves can't get through it, it casts a dark acoustic shadow behind it. It's this classic 1-2 punch, the bright spot and its shadow, that screams stone on an ultrasound. And if you look at these scans, you can see exactly what I mean. Those telltale bright spots with the dark shadows trailing behind them. Ultrasound is absolutely brilliant for spotting stones that are still sitting inside the kidney. Its weakness, though, is that it really struggles to get a clear view of the ureters. And that means it can't be trusted to rule out a stone that's already started its journey down to the bladder.
Which brings us to the undisputed champion of stone detection. A non-contrast CT scan, or NECT, has a simply incredible detection rate of over 99%. It makes no difference if the stone is radiopaque or radiolucent. CT sees them all. And really, that leads us to this simple, definitive conclusion. Because it's so incredibly accurate and it can see every single type of stone, the non-contrast CT scan is, without a doubt, the investigation of choice whenever a doctor suspects kidney stones. Finding the stone is one thing, but the real danger, the thing we're most worried about, is when that stone causes a blockage. This is when things can get a lot more serious, and quickly. The result of that blockage is a condition called hydronephrosis. Think about it. With the exit blocked, the urine has nowhere to go, so it backs up. This causes the kidney's internal plumbing to swell up and stretch, almost like a water balloon. And that pressure is what can cause intense pain and, if it's left for too long, can really damage the kidney. The CT image shows it perfectly, if rather dramatically. The kidney on the right looks totally normal, but then look over at the left side. Wow! You can see the entire kidney and the tube leading from it are just massively swollen and stretched out. This is a classic picture of severe hydronephrosis from a blockage somewhere further down. Now here is a really critical limitation of ultrasound you need to know about. In an emergency, right after a stone has caused a blockage, the kidney hasn't actually had time to swell up yet. Because hydronephrosis can take hours to develop, an ultrasound done too early can look completely normal, meaning it can miss the diagnosis in up to 30% of these acute cases. CT, on the other hand, gives us the whole story. It doesn't just show the blockage, it can trace the swollen system right down to the exact point of obstruction. And crucially, it also helps us figure out if the problem is acute, meaning it just happened, or if it's a chronic, long-standing issue. And that difference is vital for deciding on the right treatment.
Now, we've talked a lot about stones, but it's important to remember that not every white spot, not every bit of calcium we see in the urinary system is actually a stone. Sometimes the problem is inside the kidney tissue itself.
This condition is called nephrocalcinosis. And the key difference here, and it's everything, is the location. With stones, the calcium builds up in the collecting system, where the urine flows. But with nephrocalcinosis, the calcium gets deposited directly into the main working tissue of the kidney, the parenchyma. This calcification usually happens in one of two main areas of the kidney. In the vast majority of cases, about 95%, it happens in the inner part, which is called the medulla. Much, much more rarely, it affects the outer layer, or the cortex.
And if we look at what causes them, we can see a pretty clear split. The really rare cortical type is usually linked to some kind of severe, sudden damage. But the much more common medullary type, that's usually a sign of an underlying metabolic problem or a defect in the kidney's own filtering system that affects how the body handles things like calcium.
All right, for our final section, we're going to switch gears a bit. We're moving away from diseases and stones, and we're going to look at how imaging helps when a kidney is physically injured. So, a few quick facts for you. Kidney injuries make up about 8 to 10% of all major abdominal trauma, and they're mostly caused by blunt force from things like car accidents or bad falls. The classic signs are pain in your side and blood in the urine. But, and you've heard this before, but it's so important I'll say it again, a normal ultrasound does not mean there isn't a serious injury. And that is why, once again, CT is the undisputed king. When it comes to trauma, it gives the surgeons all the critical information they need in one go. Is blood still flowing properly to the kidney? Exactly how bad is the damage? And just as importantly, have any other organs nearby been injured as well? When you step back and look at it, from finding tiny stones to assessing major trauma, the evolution of uroradiology has just been remarkable. It really leaves us with a final thought to chew on. We've become incredibly good at detecting these problems once they've happened. You have to wonder if the next frontier will be predicting them before they ever even start.